So thank you for tuning in. As you know, my name is Denise, the nutritionist, and I'm here with Melissa Wong, who is the owner of Markham Pelvic Health. She is a pelvic floor physiotherapist, and I thought it'd be really fitting to ask her some questions for you guys, for your moms, just to find out what exactly a physiotherapist does, a pelvic floor physiotherapist, and why you need to see her. So Melissa, did you just want to introduce yourself?
Perfect. Thanks, Denise. As you mentioned, I am a pelvic health physiotherapist. I treat men, women, and children with pelvic health concerns. I see a lot of people during pregnancy and postpartum getting them back to their physical activity and doing the things that they want to do.
Right. Great. Thank you. So why is it, I saw a pelvic floor physiotherapist while I was pregnant and postpartum. Why is it important that moms see you or see a pelvic floor physiotherapist after they've had their baby?
It is super important to check in with a physiotherapist because it's different than just checking in with your OB or your midwife postpartum. The things that I look for, I'm looking at muscle tone, I'm looking at strength, I'm looking at endurance, but I'm also seeing what the scar healing is like, what the tissue tension is like, so that we can kind of get you back to where you want to be. And especially people think that everything is well and good at the 6 weeks, and often they are not quite ready. So it's good to just get a baseline to see where things are at to get you back to exercise.
Right. So even if a mom is not experiencing any symptoms, any heaviness, or anything that she should be concerned about, she should still come to visit you, correct?
Absolutely. I always describe it the same way. If you had an ankle injury, you wouldn't go back to running a marathon right away.
Right.
So it's important that you slowly work up to that, and to have someone guide you through that is super important to make sure that, your body is ready, because, you've held this baby for the last 9 months. Your pelvic floor is working hard for the last 9 months, and then having a baby is also a big trauma to the system. So having someone just see where your baseline is at, make sure that things are good going forward is really important.
Right. And I like how you hit on, the OBs, midwives, doctors, because I hear from a lot of moms, I was checked at my 6 weeks, I'm okay. But you are checking for much more than doctors do, because as I understand, doctors will just go in with their speculum, so with instruments, and kind of pull the muscles aside. Is that right?
Yeah, so really when a doctor does go in and check, and a midwife does check, often they actually don't even check at the 6-week point. But when they do check, they're more so looking to make sure that scars are healing well, there's no signs of active infection. They're not necessarily checking what the muscles are doing, and they're not checking for a prolapse per se, because at 6 weeks there is still a lot of natural healing going on. So the physio assessment is very different than what an OB or a midwife is doing.
Right, and you would do your assessment at 6 weeks or later? You wouldn't do it before?
Generally not. There is a lot of healing that's going on beforehand.
Right.
So we generally just say, hang tight, take it easy, check in with your OB, and once you're given the all clear to go back to intercourse and to go back to physical activity, that's the perfect time to come in and check in with a physio.
Right, got you. So can you go through with us, what exactly are you doing? I know we know doctors use instruments. Are you using instruments? Are you using your fingers? Kind of walk us through that.
Yeah, so what I do as a pelvic physio is I'm checking your back, I'm checking your hips, I'm checking your overall mobility the same way a regular physio does. The difference is that I have extra training in the pelvic health world, so I would typically go in with 1 or 2 fingers vaginally. If you're having issues rectally, I may do a rectal assessment, but we can always talk about that at the time. And I'm checking the muscle strength, I'm testing muscle tension. You're not using any instruments, you're not going up in stirrups the same way you are with a doctor.
Right.
So it is a little bit easier going
Right.
for the most part.
Right. And I know some moms ask me, I got to cancel my appointment because I'm menstruating, I'm having my cycle. Can moms come to you when they are having their period?
Absolutely. This is one of the biggest things that I get asked all the time, too. Because I'm just feeling the muscles inside the body, being on your period doesn't really affect anything that I do or anything that I'm feeling. It may be a tiny bit messier, but we have things in clinic that we do to help with that. But for the most part, being on your period, being at either the beginning or the end, completely okay to continue.
Right. And how long would the initial assessment be?
Usually the initial assessment is one-on-one for an hour with myself, and then subsequent follow-ups are typically half an hour long. For most pelvic physiotherapists, I would say it's pretty much the same kind of deal.
Right.
Yeah.
And what kind of exercises would you, I know this is like, will vary from person to person because everybody has different, what's going on, but what kind of exercises would you send somebody home with?
Yeah, so depending on what's going on, if it's more strengthening exercises that you need, we would give you some strengthening exercises, most likely Kegels, most likely a mix of Kegels plus core work. And then in some cases where the muscles are actually too tight, so imagine you walking around with your muscles like this all day long, then in that case we would be doing more lengthening exercises, trying to get the muscles lengthened and stretched out, and it may be more stretching exercises or breathing exercises to help get the muscles to relax a little bit more.
Right. Okay, got it. All right, so that's all the questions that I have for, what moms can expect when they have their initial, checkup or assessment with you. Did you have anything else that you wanted to add?
I would say just reach out if you're not sure whether you're an appropriate candidate for physio or not. You can either, chat with you, chat with me. We can always, get a bit of better idea of what the history is, and we'd be upfront whether or not we think that physio is appropriate.
Right.
Even if someone's coming in just for a baseline assessment, it's always good to just get an idea of where someone's at.
Exactly. All right, thanks so much, Melissa. As I said, Melissa is the owner at Markham Pelvic Health, and I'll put all the details below. And thank you so much for being on this call with us.
Wonderful. Thanks so much.
Thank
I look
you.
forward to talking to you guys soon.
Awesome.